Hello, it's Dr. Rhonda Johnson, Thursday, June 29th, 2023. Today I'm discussing heart disease in men because June is Men's Health Awareness Month, and I did not want this month to end without discussing the number one killer of men in the United States, and that is heart disease. Now, much of my information comes from the CDC website. Now, heart disease really is a whole bunch of different diseases. It can include coronary artery disease, a heart attack, heart failure, disturbances of the heart rhythm such as atrial fibrillation, cardiomyopathy, and there's others. As I said, heart disease is a leading cause of death for men in the United States. And when you look at the areas that have the highest rates of death from heart disease in men, these include Alabama, Mississippi, Louisiana, Arkansas, Oklahoma, Georgia, Kentucky, Tennessee, and the territory of Guam. Now, did you know that half of the men who die suddenly of coronary heart disease, that's like a heart attack, have no previous symptoms? Heart disease symptoms are often silent, but just because you don't have symptoms, you may still be at risk for heart disease. Now, I can't go into all the symptoms of heart disease, but people are familiar that the symptoms of heart attack include chest pain or discomfort in the chest. You can have upper back or neck pain, heartburn, extreme fatigue, shortness of breath, nausea or vomiting. Symptoms of atrial fibrillation include feelings like your heart is fluttering in your chest or you're having palpitations or irregular beats. Now, heart failure can cause shortness of breath, swelling of the feet, the ankles, the legs, the abdomen, or the neck veins. So who's at risk for heart disease? Well, men who have a positive family history. You know, their father, their uncle, their brother. That's what is meant by a positive family history. High blood pressure is a major risk factor for heart disease. Diabetes, being overweight, having an unhealthy diet, being sedentary, and excessive alcohol use, and having a substance abuse disorder, particularly cocaine and methamphetamine, can increase your risk of heart disease. So how do you reduce your risk of heart disease, men? Well, prevention. You've got to do these things. Number one, see a doctor. You got to get these regular checkups, and you need to talk to your doctor and develop a working plan if you have problems. Two, you got to know your numbers, your blood pressure, your cholesterol, your triglycerides, your blood sugar, your weight. And if you need to make changes, you got to start working on them. Number three, quit smoking. And these aren't in any particular order. Smoking is just bad for you, period, in so many ways. But it causes your blood vessels to constrict, among other things. Other things that you can do is make healthy food choices more often. Consider taking a multivitamin and mineral supplement, particularly if your diet has been unhealthy. Lower your stress level and find healthy ways to cope with stress. Increase your activity. You got to start slow if you've been inactive, and limit your alcohol consumption. So that's my message today. These are things that we can do to lower our risk. You can't do anything about your family history, men. But everything else is on the table, and you can make a difference. Small changes can lead to big results. That's my message today. Ladies, please share this message if you see it, and share it with the men in your family and the men in your life. And then ask them to share it. Thank you, and take care.